Hi all, this is Chirag Patel here, and thank you very much for inviting me to moderate a phenomenal session this evening. I thank TiE Hyderabad and TiE Global for giving me this opportunity, and equally, I sort of thank them to put me in a spot because the session is so broad, so compelling that I'm hoping that I'm going to get some meaningful insights from two great visionaries onto our panel today. Let me first begin with some introductions. We have Sheenu Jhawar on the panel. She has been identified as one of the top 10 emerging women leaders in the healthcare sector. She is a director on the board of Apex Hospital that runs a chain of multi-speciality hospitals in Rajasthan. She has worked in the past as the public health consultant to the government of Rajasthan, but also under a World Bank project, and has been a clinical auditor for the National Health Services in the UK. She founded a clinical governance and audit consulting firm a few years ago, wherein EY recognized it as one of the top 10 consulting firms in that sector. She has also been invited to be a knowledge partner for clinical audits in various governments, including Andhra Pradesh, and in the UK and in Africa. She is a certified NABH assessor. She's a prolific writer in Indian Express and presented paper at the AIMS. And finally, she is an alumnus of the Institute of Health Management Research and the London School of Hygiene and Tropical Medicine, and has undergone some management training at the Harvard University as well. So very illustrious career, and I'm really looking forward, Sheenu, to having a chat with you. At the other end, I have Mr. Rajneesh Bhandari, who is a serial entrepreneur of repute and an active angel investor in the North Indian ecosystem. He is an alumnus of IIT Delhi and has promoted 3 successful ventures in the telecommunication, engineering materials, and quite recently medical diagnostics sector. His latest venture is called Neuroequilibrium, which is the world's first chain of super specialty vertigo, dizziness, and balance disorder clinics. Neuroequilibrium, under the stewardship of Rajneesh, has set up 150 super specialty clinics, and their target is to reach 1 million patients by next year through remote diagnosis using cloud and machine learning. He's on the governing board of an angel fund called Rajasthan Angel Investors Network. He's an LP with a UK-based early stage healthcare and medtech fund. He's an independent director in various hospitals and institutes, educational institutes in Rajasthan. And he has 6 patents in the US and 9 patents in his name. So ladies and gentlemen, we have, I think, phenomenal and illustrious panel here today. And let me begin first by asking a few questions. But just for the panel, I just wanted to set the context. I'll break my questions in 3 parts. The first, we will focus on preventive healthcare. The second part would be on affordable healthcare. And then finally, if you can sort of sum up at what the opportunities are there for healthcare. So let me begin first with Sheenu. In your opinion, what are the top 3 drivers for preventive healthcare in India and perhaps internationally as well?
So, Chirag, we live in very interesting times, and I think we've heard this cliche quite often. But I think, like with everything else, we would like to break the healthcare era of the world and of India into a pre-COVID era and a post-COVID era. And a lot has changed since. So if we were to look at any driver of healthcare and of preventive healthcare in the pre-COVID era, I think the need was not really to stay healthy. The need was to pay less for a clinical incident. And the 3 main drivers were whether the consumer, and who is the consumer that needs to be defined, an individual or the governments, the nations, what would they be willing to pay? What was the perceived benefit? There were 3 drivers, like I said. The most important was the funding. And the funding came in for immunizations because nations wanted to have a good matrix of their populations for the rest of the world. And there was a lot of money flowing in. So all the preventive healthcare was focused primarily on the immunizations and on maternal and child health. That was very typically a model for most of the low-income countries and the countries which were high on the radar of their healthcare metrics. The second one was the typical US model, which is the health maintenance organization model, where people were paying out of pocket. And again, when they were paying out of pocket, the focus was on whether they can pay less today instead of paying more tomorrow. So the focus again was not really on preventive healthcare, but on how much money they have to dish out for a clinical incident. And the third model was a government spend in countries like Canada, in countries like UK, where the governments were responsible for the health of their populations. They were trying to curb the cost of treatment, and therefore they were trying to go for screening tests, which again was a very heavily a diagnostic model and not really a preventive healthcare model. Now sweeps in the post-COVID era. And as we go into this discussion, I will also refer to the report by Deloitte, which has touched upon it has looked at a very large survey, and it has come up with the consumerism in healthcare, and we're going to talk about that. But before that, what's really going to drive healthcare into the future is the need for staying healthy. And if entrepreneurs can touch upon this need, either of individuals or of the nations, to understand what is a consumer willing to pay for, I think that is what is really going to drive the true sense of preventive healthcare into the future. And that is where there's a whole big bucket of opportunity which exists in India and abroad.
Thank you, Sheenu. Same question for you, Rajneesh. I guess there's a cue here is that if we all stay healthy, then obviously we reduce the aggregate nation's cost. So what are your views or three drivers for preventive healthcare?
Yeah, so, I will take the cue from Sheenu, and I would say that as per the published research, and it is very interesting, the top three drivers for health are genetics, behavior, and social strata. By social strata, I mean, like in the case of US, it is actually the zip code, which determines your health. And so the top three drivers for preventive healthcare for me become healthy lifestyle, periodic screening, and changing the environment around you. To give you an example of changing the environment around you, in companies which have a culture of organizing regular half marathons, most employees are fit. I believe that these are very great business ideas, and globally preventive healthcare is valued at about $200 billion, where mostly it is startups which are in the foray. So these are the three drivers for me.
So following on with that, Rajneesh, what do you think are some three ideas which come up from these ideas? What do you think one should do? Like self-care, healthcare, or what do you think?
So I think the biggest idea is making healthy living a cult or an addiction. So you have companies like PureFit, which are giving better food and fitness, valued at about $800 million. You have Fitbit, which was acquired for $2.2 billion. Our own homegrown Goki, valued at more than $100, also part of TiE ecosystem. And as per Red Sea report, this is $100 billion opportunity for startups in the next 2 years, because today we have more than 90 million health conscious individuals in India. So I think the biggest idea is, and that is where everyone is wanting to go, can you make healthy living an addiction? And that is the biggest preventive, biggest thing in preventive healthcare.
Okay. Excellent. Sheenu, you think, according to you, what are some ideas in the preventive healthcare which you think one should pursue?
Yeah, so this is again very interesting. Again, there is a dichotomy, because for me, what is very, very important is to understand who is the consumer. And the moment you understand the consumer and you understand what drives the consumer, what is the perceived benefit to the consumer, you begin to understand what he is going to pick up. So again, for me, the consumer is going to be two. It's either an individual, right? And again, picking up from what Rajneesh has said, and if you look at the Deloitte report, there are a few parameters which define the consumer, the individual of today. There is a lot of engagement with one's own health and in healthy behavior. There is a willingness to access healthcare, even if it is virtual, and people were not really very comfortable with technology earlier, but now they are. Then there's a willingness for tracking the self-health conditions in a real-time way. There is a belief, there's a strong belief, and this is research-backed, that medical devices change health behavior and health behavior changes health outcomes. There is also a willingness to share your health personal data, which perhaps earlier was not found in the consumers. And there is adoption of apps which are specifically related to genetic testing. So this is when the consumer is an individual. But I'm going to come to another point, and then I'm going to try and link the two things. If you look at the governments, if you look at, let's say, the US government or the UK government or the Canada government, where the governments are paying for the preventive healthcare of its population, they have started looking at the cost effectiveness. And they have found that, contrary to the belief that if we buy preventive healthcare, it actually reduces the cost of treatment, that is not true. So what they say is that if a country spends X amount of money on preventive healthcare for its population, it is not really tapping into the actual patient who is at risk, because that percentage is very small. So what can we do here? So you would be surprised to know a lot of countries have withdrawn their preventive healthcare programs because it is not cost effective. So when we look at individuals who are interested in their own health, and when we look at governments who are trying to put their dollars and pounds and rupees in the right bucket, we find three very clear scenarios that emerge and that are linked from one to the other. The first is it possible for entrepreneurs to hit upon the right technology to find the actual patient who is at risk? Whether it is genomic testing, whether it is medical devices, can we find the patient who is at risk? Can we track that risk in real time? And can we connect that risk in real time with a healthcare provider? So I think if we are able to link these three things, again, there is a huge opportunity for entrepreneurs, whether it is fintech to make it affordable, or whether it is pure scientific technology, where you actually work on the genomic part and the other part. So I think that, to me, I think these are the three things which get linked together, no matter who the consumer is, and present a very large canvas for preventive healthcare the world over.
Yeah, interesting. I think what both of you are saying is that there is a myth that as nations, if we spend money on preventive healthcare, we will have positive outcomes. But I think you're breaking that myth. And instead, what you're saying is that we need to understand consumer behavior and build products and technologies so that we can get to the at-risk patients faster and therefore reduce our healthcare cost in general. Very interesting insight. Thank you for that. Equally, what do you think are the barriers to scaling up, Rajneesh? Whilst all this is all good, and it's knowledge and it's information and it's thought-provoking, but clearly there are some barriers, and there's some practical barriers if you can focus on, please. Thank you.
Yeah, so I'll just make one line comment before I come to the barriers. I think the point is that preventive healthcare, so we have to move from being episodic and reactive to preventive, and that will happen over time. I think what Sheenu is referring to is that the data that what was required to be done for preventive was not correct, and so the outcome may not have been good. But overall speaking, there is a need to do the correct preventive healthcare so that we do not have reactive healthcare. So now coming to barriers, I think preventive healthcare rarely generates opposition. Yet most consumers regularly choose not to adopt it, correct? And the primary reason for that is actually cognitive biases. I know this is not a class in psychology, but this is something which is very important for startups to understand who are trying to build apps and other healthcare services. I'll just give you two examples of cognitive bias, which are very important in preventive healthcare. One is like omission bias, correct? Which is basically avoiding making a decision when confronted with contrary information. So like polio vaccine not being adopted by a certain section of the society. The other bias is nocebo bias. Too much information. If I keep Googling on the side effects of a vaccine, I will never get a vaccine. Now, so a very important suggestion to these startups, as I said, is there is this book called Hooked, which is on how to build habit-forming products by Neer Year. And this has changed the way we have built products. And the reference to this is I was in a TiECon and he was a speaker there, and it was eye-opening for me. So I think if the biggest barrier is cognitive biases, and if we can change that, there are two other things that I want to talk about why scaling up is not happening. The second point is on startups being able to get the requisite, basically customers in the first place. Just to give you an example, there are about 50 startups working in different screening devices for different kinds of cancers. There is Niramai for breast cancer. There is Oral Scan and Atom 360 for oral cancer. There is Alendra system for cervical cancer. There is it's difficult to pronounce the name, Theranosys Life Sciences for liver cancer screening. Now, most of these single screening devices or single device companies are struggling in India because customer acquisition is a Herculean task. It would be great if somebody like GE Healthcare or even Ayushman Bharat were to integrate these services and offer an integrated solution for screening, making the task of marketing easy for these startups. So I think getting the first set of customers is a huge challenge. And the last point on barriers to scaling is that in India, insurance does not cover OPDs, it does not cover screening, let alone other preventive healthcare inputs. So we are only insured if we fall sick and are hospitalized for a day. I think if preventive healthcare has to scale up, this has to change dramatically, and insurance has to be ready to fund the preventive to prevent long-term disease, basically. So these are the three things I would say which are barriers to scaling.
Thank you. Sheenu, there's a question from the audience which is targeted at you, which asks you a very, very, very fundamental question, is that if we do more of preventive healthcare, what does it do to the business model of the healthcare industry in general? Does it not reduce the need for traditional healthcare? What does it do to them? And how do you sort of create a balance, Sheenu?
Sheenu, you're mute.
You're mute. We can't hear you.
I'm sorry. So I think, again, it depends on who's paying. If it is a country like India, yes, traditionally, hospitals do not want you to work too much on preventive healthcare. But then again, traditionally, I think there was a community in China and years ago, where the money came into a community and the health keepers of the community if the community was actually well. And that is the same fundamental on which UK healthcare system is built. So that is why they will force the population to get their screenings done, because if it is well, then they get a better chunk of the money from the government. So I think, to me, it's, what drives really is either the perceived benefit of the consumer or where the money is going to come from. So unfortunately, we can't really do anything about that.
Right. Okay. Thank you. Thank you for your honesty. Now, I want to try and sort of wrap this session up, and I'm asking this question openly to both of you. What is the role of technology in healthcare? Can you be a little bit more specific by giving examples so it'll be useful for our audience to capture that? Rajneesh,
yeah. Okay. Yeah. Okay. So I think three roles I can think of. One is what I talked earlier. The technology can help fitness become a cult or addictive. So people don't buy an Apple Watch, to look at the time. It's actually a health and fitness wearable with addictive features like tracking your fitness, heart health monitor, fall detection, noise level indication, altimeter, how much have you climbed in a day? Did you stand up every hour and all? And it is technology can help in making it personalized and so even more addictive. So at 7:15 a.m., if I have not, started my walk, it will basically remind me to start my walk. And so this is, I think, one part of the technology. The other part of the technology is making screening cheaper and more accessible. So handheld mammography by Niramai, which is 1/5 of the cost, handheld retinopathy devices by Forus and Siemens and things like that. The third is that preventive health checkups are not actionable. while technology can help them make becoming actionable and complete the cycle. I'll give you our example. So we do specialized preventive health checkups for old patients who have frequent falls. And we use ML to give actionable insight and then provide them with the requisite therapy, which is also driven by ML and algorithms. So I think completing the loop is very important. And to summarize the section on preventive healthcare, I would say we have to move from sick care to healthcare, from reactive and episodic to preventive, predictive, and personalized. Thank you.
Thanks. Sheenu, I'll give you a last shot, 30 seconds. What do you think? Role of technology?
I don't think I can better the guru here on technology, but all I'm going to say is that there's a huge, huge, huge market. And it is not just in the devices or in the product itself, but it's also in the analytics, because it's going to give a great insight to us about the populations, about their behavior, about how diseases flow, about the demographics. And I think it is building a lot of intel as we go along. So again, it would be two prongs. So one is the actual product or the service, and the second is analytics and how you can better your product or your service going into the future by focusing on that part.
Excellent. So, excellent. Thanks a lot. I'll move on to the next section. But I think something struck me here, Rajneesh, when you said that we need to make technology addictive. So we need to get out of the addiction of other things and get this into addiction. This is an interesting healthcare problem for the future, I guess. Anyway, affordable healthcare. That's the next section which we want to do. This is also a very interesting angle to the whole healthcare system. And Sheenu, let me begin first by asking you, how would you define affordable healthcare? Because it means different things to different people, to society in general. And who do we mean when we say affordable? Affordable for whom?
So this is very interesting, Chirag. I mean, if we are becoming a hub for medical tourism for the rest of the world, and they want to come to India, it speaks a lot about the standardization and quality of healthcare. But it also means that healthcare is definitely affordable. Now, the next question is going to be, but look at the purchase parity of our populations and where we stand as an economy. So, well, we are we're the third largest economy, right? And in terms of purchase power parity ranking, we are the third largest after China and US. And at the same time, we are spending barely between 3.5 to 4% of the GDP on healthcare, whereas the rest of the nations are spending between 10 to 11% of the GDP on their healthcare. And these nations are much lower in the purchase power parity, but they are the top 10 best countries of healthcare delivery in the world. So there is a lot of question mark into what really is affordable. How do we define affordability? If we were to understand that there is a little bucket from which the consumer pays for his healthcare, it is the question of how much does he think is the right allocation towards his own healthcare, and does that shift require a change rather than the actual question of affordability? The second part is, if there is a fixed cost to healthcare, and if the consumer is not willing to pay that fixed cost, what is the government's role in subsidizing healthcare so that it makes the healthcare affordable for its people? So I think we'll have to approach this question with a lot of different directions to really understand affordable for whom, and affordable, what is the benchmark for this affordability?
Yeah, so Rajneesh, I think what Sheenu is saying is that broadly, that there is an arbitrage at a sort of a country level in India, a cost arbitrage for other nations and their patients to come here because in general it's slightly cheaper or affordable. But at a unit level, at a consumer level, it is perhaps not. And therefore it's not affordable for them. How do you see this? How do you see this structure? What is your definition of affordability?
So I think my simple definition is that affordable healthcare is what is accessible to all. And I think that's the simple statement on affordability.
Okay, interesting. So accessibility, and therefore there is a policy and there is a responsibility on the healthcare service providers at all levels to make sure that it is accessible at different stratas of society. Okay, interesting. If the healthcare cost in general is the lowest in India, then what else can we do, Rajneesh, in order to drive this accessibility?
Okay, so I think three things. One is, of course, universal insurance coverage, which will meet my definition of accessibility. Mm-hmm. But I think there are 2 or 3 more interventions that are required to drive down the costs without compromising on the quality of healthcare. I think the quality of healthcare with time, 5 years from now, 10 years from now, has to be much better than what it is today. So without sacrificing on quality. So there are 3, suggestions or inputs that I have. The first thing is that the top 10 causes of death in India today require treatment by a super specialist. For 72 million diabetic patients, we have just 800 endocrinologists, and 500 of them are in 8 cities. So for the rest of the country, just 300. As per the US or European standards, we require about 30,000 endocrinologists. Similarly, we have 4,000 neurologists, we require 40,000. We have 1,200 nephrologists for 1.3 billion people, and we require at least 40,000. Now, business model innovation and technology will have to be a force multiplier to solve both the problem of accessibility and affordability. The marginal cost of providing super specialty healthcare service can reduce dramatically. So just to give you an example, we are providing super specialty healthcare across 150 hospitals in India and a few centers in Europe in the domain of vertigo, dizziness, and balance disorders by our own super specialist doctors, assisted by computer vision and machine learning. And it has been a force multiplier. With a small team of doctors, we can cater to 150 centers, correct? So the marginal cost of providing super specialty healthcare goes down. This is the model that we will have to follow across. You have seen this model in tele-radiology already, where the first phase was US MRI scans being read in India. And now it is AI doing the reading and providing the results. So the marginal cost goes down. The second input is that virtual consults, which have been accelerated by COVID, I think they will save a few $1 billion every year in India on OPD cost, as most reports say that 30% of the OPD will shift online. So you have Practo, 1mg, Apollo 27, 24/7, and many other startups which have come in. So we expect about 50 million households to be doing virtual consults by 2025, mostly under the subscription model. So I think this will reduce the cost. This third is basically home healthcare, which can reduce the cost by at least 40%. And it's an $11 billion opportunity by 2025 for startups. And companies like Portia, Apollo Home Care, etc., have done the initial work. Interestingly, it will also reduce the hospital unnecessary visits by about 60 to 65%. So I think these are broadly the 3 things which going forward will dramatically reduce the cost.
Sheenu, I think these are earth-shattering statistics for your business in terms of disruption going forward. So how would you respond and react to these eminent challenges which are perhaps coming in the broader healthcare sector with the drive for affordability?
So again, I'm going to say 2 things to you here. I'm going to say one thing to you as an entrepreneur within healthcare. So if things are changing in healthcare, then we have to adapt because we are not outside the system, we are part of the system.
Right.
And the other thing, I'm going to speak to you as an entrepreneur, and let's look together at the opportunity for further taking the cost of healthcare down. Now, when we look at affordability, we are looking at a clinical incident. Somebody has fallen ill, they have to pay for that treatment, and therefore they judge whether they can pay for it, they cannot pay for it, do they have access to their treatment because of money, like Rajneesh says. Once they are out of the hospital, then starts living with the problem, which is a chronic stage. Now, 20%, for example, in India, 20% of the population is living in that chronic stage, 200 million people, of which 100 million people are living with diabetes and hypertension. Is there a space for entrepreneurs to touch upon this population so that their need for going back into the hospital gets reduced, and therefore the existing infrastructure becomes available to a larger population, thereby reducing the unit cost and making this segment more affordable. So, and very interestingly, when I was on the net and I was researching for this, I found that many countries have entered into what is known as a social impact bonds. So they're working with this population, and they're trying to fund this so that the health outcomes are better, and that is driving them to access healthcare lesser, and without any more capex investment, you have the same facilities become cheaper for the population. So that's, as an entrepreneur, there's a huge role to play there, a huge opportunity. As an entrepreneur within the system, I think that's a great opportunity for me, because as part of my own brand, and I know that many other people, my colleagues in this industry, we are now working on tele-ICU, we are working on tele-onco, tele-radiology. So imagine that one oncologist who was very expensive because of a limited number of volume coming in the brick and mortar model, we're now able to cater to a huge population in Rajasthan because of this technology interfacing. So I think I'm very happy as an entrepreneur, even within the healthcare system. And I think if I adopt this disruption, it's for my own benefit. And of course, there's a huge benefit to the public as well.
Sure, yeah. So I think there is a role for brick and mortar. This is not just, either or situation. It's just that you can focus and target your efforts towards the here and now. And there's whole prevention, which is happening largely. And there are, technology as a medium, it seems. But specifically, do you think from an affordability perspective, is there a role for technology? I'm sure there must be, but can you give us examples? Can you give us some examples?
So, the best example is, let us even forget the cost of the treatment now because of technology. Let's look at the out-of-pocket expenses. So all the expenses which were being incurred because of the travel, because of the loss of earnings, I think all of that is saved, and therefore healthcare has become more affordable. And technology, of course, has taken the costs down, but there is one very big ill with it also. So when we talk about, for example, the OPDs becoming free, Rajneesh, I immediately penciled in a little point, because when you make healthcare free at the point of delivery, suddenly there is a huge need for healthcare amongst the people. So maybe the infrastructure actually faces a challenge because suddenly people want to access healthcare more. So I think a balance will have to be found. We still do not have the elixir which says that this is just the right kind of ingredient for making things accessible, affordable, and within reach of all segments of the strata. I think we're still looking for that magic potion, really, Chirag. I don't think we have it with us yet.
Okay. Rajneesh, in your view, is there a potent example you can give?
I'll put two small examples. We are like the white hat junior for vestibular rehabilitation, providing services across India, leveraging technology, virtual reality, algorithms, etc. And our algorithms and machine learning drive rehabilitation, which is progressive, adaptive, and customized, and thus ensuring excellent, patient outcome. Another example. So if a diabetes patient goes to a super specialist, the doctor takes a short history, writes certain tests, and then the patient comes back the next day with the report of the blood test. And it is then that the super specialist actually applies his or her mind to write a prescription or her specialization. So our clinical decision support system takes a detailed history, digital history, and then algorithms recommend the blood tests. And that saves the first visit to the super specialist, and thus enhancing the efficiency in the system. So these are two quick examples that I can think of.
Excellent, thank you. And I'm sure, I think 20 minutes is not enough. This is such a vast topic, but it'll be interesting for both of you perhaps to write a paper and publish it so that, this thought process transmits particularly within our TiE community. Okay, I want to move on to the last section because that's very important. That's relevant for a lot of our audience here. If you can articulate specific opportunities which you probably see right here, right now, notwithstanding COVID, what would they be for startups? And also, if you can touch upon very quickly, is there a role for the government to play to make these startups more prolific?
Me first?
Yeah, Rajneesh, yeah.
Okay. So I think, as I said, in various reports, $100 million is the opportunity for startups in preventive, affordable, and other healthcares. So a few things which are on the horizon and exponentially growing. So, of course, India is the diabetic and corona heart disease capital of the world, but there are, huge, whether you take cancer or anything, India has the numbers in every domain.
Mm.
So I'll give 5 or 6 in quick this thing. So genome sequencing for actionable insights. So the genome sequencing for consumer, insights is actually a story which is not picked up. But things like there is a company called Grail, which has raised about $1.6 billion. And it is about liquid biopsies. So those kind of things are scaling up very fast. You have microbiome for the gut. I think that is something which is taking up, very well. And you have companies like Ginkgo Bioworks in US, which have got about a $700 million funding. Mental health is the third thing that I would say which will take up, and I think Sheenu is an expert on that. Home healthcare and telehealth, virtual healthcare, I've already talked about. I think the role of 3D printing in healthcare. So all our equipment are 3D printed. And I think that is a huge game changer. Use of virtual reality and augmented reality. So we use virtual reality for rehabilitation of the patients. We use augmented reality for training of the doctors. The last two I would say is one is electroceuticals. So this is a new domain, where you have basically electronic gadgets which can modulate do neuromodulation. So we are working on a wearable for managing headaches. So this is a new domain that has come up. And then targeted and personalized medicine. So I gave the example of targeted and customized, algorithm-driven rehabilitation. The last I would say is robotics, where 5 years back, there was one company in surgical robotics. Today, there are at least 150 startups which have applied for CE or FDA certification across the world. So I think this is the domain.
Fantastic. I think it's very overwhelming for somebody who's not in this sector, Rajneesh, but yeah, phenomenal. Well thought through. Sheenu, my same question to you. This is the last question for the panel. What do you think are opportunities for startups from
when we talk about preventive healthcare, I'll deviate a little from healthcare as well. So one is clinical decision support software. Anything which tries to standardize healthcare decision making is, of course, you're replicating the number of doctors that are actually training them and having gone through that entire cost. So that is there. Then, manufacturing of low-cost implants and surgical material, that is very important to take the cost down, although that's not preventive. Impact investing, like I said, in preventive and chronic stages, immunity and diet, fortified agriculture, organic homegrown kits, organic food, for example. The data says that we had a market of 1,200 CR last year. It has grown to 2,000 CR this year. And it is really, really, increasing. Alternate medicine, homeopathy, Ayurveda, fitness, consumerism, everything around it, robotics, like Rajneesh has said, fintech to make the healthcare affordable, insurance, the hygiene industry, whether it is the paints, the fabrics, the products, the sensors, electronic medical records, and something like a national Aadhaar card, which links the entire data. And it is not just for ensuring that a specialized doctor is not looking at a normal problem, but it's also building and linking the data so that you have a better baseline for artificial intelligence going forward, because if you do not have that data, you can't really build it into the AI. The telecom bandwidth, because if this, the healthcare in your palm has to go to the last mile, then you have to have that bandwidth as well. The online consumerism of pharmacy, I think that's one place which has gotten a lot of investor and a VC interest. All the SaaS models of shared service delivery, I think that is very important. And of course, what takes the cake for me always, the cherry on the cake, is mental health. I think I see a lot of opportunity there.
Interesting. Interesting. If there is one thing I would take away in this session, and perhaps throw it back at both of you, is that perhaps both of you should start some an incubator or an accelerator for this sector in Rajasthan. I think I'm going to drive that agenda very, very passionately, but very, very interesting. Thanks a lot. I mean, I've known both of you for many years, but this has been the most insightful conversation, and my respect for both of you has only gone up a few notches. I also, once again, thank TiE Hyderabad and TiE Global for giving us all of this opportunity to discuss a very, very large and a very interesting sector which is opening up in India, and perhaps it will attract a lot of foreign investment through VC and private equity as well. So once again, thank you very much, and see you soon. Thank you.
Thank you very
Chirag.
much.
Thank you,
Thanks,
Sheenu.
Chirag. Thanks very much.